There's a plague killing people right now in the US. And no, I'm not just talking about the measles outbreak. This is a pernicious plague that, although it has been infecting our country for some time, has been spreading rapidly and becoming more lethal in the past few decades. One scientist with a degree in being furious about anything, anywhere, all the time, called this disease greedy, evil, stupid, for-profit healthcare syndrome. People in the US are struggling with this disease. Some people can't get health insurance. Even those with health insurance are struggling with claim denials, prior authorization denials, exorbitant prices, and a lethally sluggish system. I'm one of those people struggling with this uniquely American disease. I have Crohn's disease, a chronic illness that causes inflammation in my large intestine, and comes and goes in flares and remissions. Last year, from around the beginning of March to the beginning of April, I had a very severe flare. I did not go to school for a month because I was in excruciating pain for much of my days. I spent at least an hour every day in the bathroom. I was very fatigued. I went from 120 to 95 pounds despite my attempts to overeat. Luckily, there are biologics that can keep me in remission. Until November, I was getting infusions of Remicade, which kept me in remission. However, my body developed a resistance to the drug, and I was also having severe infusion reactions, so I could no longer take it. Since December, my gastroenterologist and I have been trying to get me on a different biologic, to no success, and since then, I've been taking a steroid meant for short-term use. Throughout this video, I will answer the question, is the existence of the health insurance industry and the commodification of healthcare ethical? As I'm sure you can tell, my answer to this question is no, and you'll know why by the end of this video. I will occasionally mention my own medical experiences as it relates to these topics. To start, I'm going to explain just a little bit about health insurance, although this is partially for myself. I admit that before starting this project, I didn't know much about how health insurance works, so maybe I'm underestimating how much other people know, but it'll still be helpful to go over this. So you pay a premium on a regular basis, probably monthly, to have health insurance. In return, your health insurance is supposed to help cover medical expenses. You pay for the entirety of most of your medical expenses until you reach your deductible, after which insurance kicks in. At this point, you start paying only the amount of a copay and/or co-insurance. A copay is a fee that you pay depending on the type of care, whereas co-insurance is a percentage of medical expenses that you pay. The out-of-pocket maximum is simply the maximum that you can pay out of pocket before insurance is supposed to cover 100% of expenses. Now that we've got that out of the way, let's start talking about the problems with health insurance. First of all, let's talk about claim denials. Every time you have a medical expense, a claim has to be filed to the insurance company to get reimbursement, to actually get the benefits of your health insurance plan. Your healthcare provider usually does this for you, unless you go to a healthcare provider outside of the health insurance plan's network. However, if a claim is denied, it means that insurance refused to pay anything. Unless you're rich, you basically need your claim to be approved in order to be able to afford treatment. Unfortunately, claim denials are common practice. Quote, nearly 15% of all claims submitted to private payers for reimbursement are initially denied, including many that were pre-approved to move forward through the prior authorization process. We'll get to prior authorization later. Additionally, quote, denied claims tend to be more prevalent for higher cost treatments, with the average denial pegged to charges of $14,000 and up. What this effectively means is that the more you need your health insurance, the more expensive your treatments are, the less it works. Health insurance works when it isn't needed and doesn't work when it is needed. It's how they make profit. Also, quote, 54.3% of denials by private payers were ultimately overturned and the claims paid, but only after multiple costly rounds of provider appeals. And, quote, the average cost incurred by providers fighting denials is $43.84 per claim, meaning that providers spend $19.7 billion a year just to adjudicate with payers. End quote. It's sad that only a little over half of the denials are overturned, but what's really notable to me is this. Health insurance companies deny claims because they know that a lot of people won't appeal them due to the costs, so they can just get away with it. There's pretty much nothing stopping them from denying claims without reason. Also, look at this graph. You can see here that Medicaid is the worst in claim denials despite being intended for lower incomes, i.e. those who have even less ability to pay for healthcare on their own. This is just another example of health insurance working worst when it's needed most. and working best when it's needed least. Additionally, quote, insurers of qualified health plans sold on healthcare.gov denied 19% of in-network claims in 2023, end quote, a worse rate than for all private payers, and, quote, of limited information available on in-network claims denial reasons, the most common reason cited by insurers was other at 34%, followed by administrative reasons, 18%, excluded service, 16%, lack of prior authorization or referral, 9%, and only 6% based on lack of medical necessity, end quote. Quite frankly, these are BS reasons. Other being the biggest reason is a joke, and it further obfuscates an already opaque system. Administrative reasons is vague and has nothing to do with one's actual medical situation. I don't even know what excluded service is supposed to mean. And on lack of prior authorization, just know that prior authorization is also stupid. We'll get to that. And don't forget that even after prior authorization, many claims are still denied. Only 6% of claim denials are actually based in lack of medical necessity. And still, even then, I would bet that many of those denials are unjustified. This means that at best, 94% of claim denials are just unnecessary BS, meant to further profits at the expense of our health. And, quote, consumers rarely appeal denied claims. Fewer than 1% of denied claims were appealed. And when they do, insurers usually uphold their original decision. 56% of appeals were upheld, end quote. Again, the high cost of appealing denied claims, along with a mediocre success rate, deters anyone from actually challenging such an evil practice. Now, I've mentioned prior authorization a few times so far, so let's actually talk about it. What is prior authorization, or prior auth for short? From the American Medical Association, quote, when patients go to the pharmacy to fill a prescription, they are often told that their insurance company won't pay for the medication unless a physician obtains approval. This tactic, used by insurance companies to control costs, is called prior authorization, end quote. Basically, insurance companies require another unnecessary step of approval before a provider can order a prescription. One dermatologist and former president of the American Medical Association said that prior auth is just a way for health insurance companies to pay less, and that for a majority of the prescriptions he writes, he needs to go through a, quote, arcane process to get approval from insurance. Arcane is absolutely the correct word to describe this system. It's more difficult to understand than an Elder Scroll. He said that a major part of discussions with patients has to be predicting what treatments they can get approved, rather than any other important discussions. This is something I've experienced with. For the past few months, the only thing that me and my gastroenterologist have discussed has been what biologic I can get. Yet, the people at insurance companies denying prior authorization don't know the treatments or even the conditions of the patients. They're not fit to be telling doctors what's best for their patient that they don't even know. The prior authorization process isn't meant to serve any medical purpose, only a greedy, profit-driven one. Prior authorization hurts patients. Doctors end up spending vital time fighting for a prior auth appeal rather than actually helping patients. Sometimes patients give up on trying to get treatment because they can't deal with the prior auth process. Quote, data from 2022 showed that 7.4% of all prior authorizations were denied or partially denied. 94% of physicians reported that prior auth led to delays to patients' access to necessary care. 24% of physicians reported that prior authorization has led to a serious adverse event for a patient and their care. Among the physicians the AMA surveyed, these shares said that prior authorization resulted in a serious or adverse event leading to a patient being hospitalized, 19%, a life-threatening event or requiring intervention to prevent permanent impairment or damage, 13%, a patient's disability, permanent bodily damage, congenital anomaly, birth defect, or death, 7%, end quote. Prior authorization is just meant to deny more people the treatment they need so that health insurance companies can save a few bucks. Their twisted priorities are hurting and killing patients. I haven't been able to get a biologic for long-term use approved so far because prior authorization keeps getting denied. Here's some screenshots from my messages with my gastroenterologist. Please notice a couple things. 1, that first message about the denial of Entyvio is from December. I still haven't been able to get another biologic approved since. And 2, you know it's real bad when you get a message from your doctor titled CVS Caremark Insanity. We're gonna get back to CVS Caremark, don't worry. And here's some messages that should illuminate how bad this process has been. Emmett, as you likely know, CVS Caremark refused to pay for Stelara, even though it is approved for use in patients less than 18 years of age. I had my team call the CVS Caremark pharmacy team to see if there is an alternative that they would approve. Apparently, the only biologic Crohn's therapy on its formulary is infliximab, Remicade, which you have developed resistance to. The pharmacist thought that the criteria for patients to be 18 years old or older to access other biologic therapies may be removed on the 1st of January 2025. If this is true, I can try again for approval in a few days. So Entyvio was denied, then we tried Stelara, which was also denied. After this message, we tried to get Entyvio again, since the age requirement was supposedly removed. My dad talked with TouchCare, a quote, healthcare concierge service that he gets through his work, and this is what they told him. I wanted to provide an update regarding the coverage for Entyvio. The insurance has confirmed that they will not cover Entyvio due to your son's age, and unfortunately, no appeal would change this outcome. However, there are covered alternative medications that do not have age restrictions and will be covered, pending prior authorization. These alternatives include Tysabri, right? Oh, medication is so hard to say. Tysabri and Stelara. After this, my gastroenterologist reordered Stelara on the 29th of January. Then we received this message. We again requested an authorization for Stelara, but received another denial letter dated 1st of February 2025. Really, it's impressive how fast they're able to deny people the medication they need. That was within a few days. After almost a month of nothing happening, I messaged my gastroenterologist about any potential next steps. Here's what he said. Your insurance denied Entyvio again due to your age. Again, there is no information about what would be covered or how to reach anyone to discuss alternatives. I've dealt with some fairly opaque insurance processes, but this one takes the prize. I wrote a letter asking for guidance on formulary medications for patients less than age 18, but have heard nothing back. At this point, I'm at a loss. I spent an unfruitful hour trying to find someone at the insurance company to talk with. If you, your father, or the insurance broker's office has any idea who I can talk to, I'm willing to call. It's been 3 months and no progress has been made. I'm still on budesonide, a corticosteroid that I was only supposed to take for a while, as we waited to get a biologic approved. I think it's time I direct some of my fury at one entity specifically that's been mentioned a few times. CVS Caremark. CVS Caremark is a pharmacy benefit manager, a PBM. It's owned by CVS, which means it gives preferential treatment to CVS pharmacies and can work with CVS pharmacies and insurance to increase prices as much as possible. CVS is basically vertically integrating by trying to buy every part of the supply chain. And as you can see here in this picture of reviews for CVS Caremark is hated, and for good reason. PBMs basically get to choose what medication you can get through your insurance. They also determine how much insurers pay drug manufacturers and how much insurers pay pharmacies. They're really just a middleman that is meant to increase prices for consumers. They negotiate rebates or discounts, really, from drug manufacturers to insurers. They take some of the money from rebates for their own gain. This essentially means that they are incentivized to get the biggest discounts from manufacturers while putting the most expensive drugs on their formularies, the list of medications that they'll approve. So you pay as much as possible and they get more money. Also, quote, spread pricing, when PBMs receive a higher payment from insurers for a drug than the amount the PBMs pay to retail pharmacies for the drug, helps PBMs profit by capturing this difference, end quote. This kills independent pharmacies. To help better explain PBMs and their effects, I'm going to show a bit of the video Why CVS Sucks Now and Is Getting Worse by More Perfect Union, because I can't really explain it as well. I recommend you watch the full video, however.
They're called PBMs. I'll keep it very brief. I did a whole video about them. Basically, your insurance hires them to handle prescription drug payments. And what do you know, CVS owns one of the largest PBMs in the country, Caremark.
So let's unpack that for a second.
This is Antonio Chacha, the former head of the Ohio Pharmacist Association and an advocate for drug pricing reform.
One of the largest companies in America gets to tell the patient where they can and can't get their medicines filled. They get to set the co-pays from one pharmacy or one drug to another. They also get to arbitrarily set the rates of reimbursements for the pharmacies.
With its massive market power, CVS is able to shepherd the most profitable prescriptions away from any non-CVS pharmacy and into their own stores.
When I submit a claim for someone's insurance, and I'll bill it to the CVS Caremark, and it'll say, oh, sorry, this prescription can't be filled at Jolly's. It has to go to CVS Pharmacy.
PBMs are pretty messed up. Since they decide what medication I can get, let's look at their formulary to see why they keep denying prior authorization for my medications. Here's the formulary for this year from CVS Caremark. Notice that AGE for age limit. Also notice how Stelara, there at the bottom, doesn't have an age limit. That pharmacist who told my gastroenterologist that the age requirement would be removed was right. So why am I getting letters that my requests are being denied because of my age? Who knows? Also, let's look at the 3 requirements/limits that are listed. SP means specialty drug subject to specialty guideline management. I have no idea what this means. Try to look it up and you'll get limited results of lists of these drugs, the specialty drugs, with no explanation of its actual meaning of what specialty guideline management is. It's just another stupid, opaque, arcane, obfuscated element of this healthcare system. The health insurance industry is so blatantly unethical. Their business model is to deny as many people their care as possible without losing their customers so they can save as much money. They make a system that could be so much easier into a convoluted, arcane labyrinth. Health insurance should not exist. So, I've spent a lot of time talking about the problems with health insurance. So, surely the best option is to forego health insurance, right? Not really. From the KFF in 2023, quote, nearly half, 49%, of uninsured adults say they have difficulty affording healthcare costs, more than double the share of those with private insurance, 21%. Health insurance still saves you money when you have healthcare costs. The problem is that many people can't afford health insurance, and then even when people can, their health insurance does a poor job. Quote, the number of people ages 0 to 64 who were uninsured held steady at 25.3 million in 2023. However, the number of uninsured children increased from 3.8 million in 2022 to 4 million in 2023, end quote. And, quote, most uninsured people are in low-income families, end quote. I don't even need to explain why that's bad. Nobody should be going without healthcare, especially children. And for people who have lower incomes, getting hit with a medical expense without having health insurance just makes their situation worse. Quote, in 2023, 63% of uninsured adults ages 18 to 64 said they were uninsured because the cost of coverage was too high, end quote. Now, let's look at the map of the United States by state. So you can see where rates of uninsurance of the population having more uninsured people are worse. Texas is, it's terrifying, really. It's the darkest color on the map. And also the rates are higher in the southeast and the center, like kind of Wyoming area of the United States, which should come as no surprise for those who are politically inclined. And just to be clear, not having insurance is not an individual failure. Most of the people who are uninsured work a job. They're not lazy or whatever. They don't need to pick themselves up by their bootstraps. This is a problem with health insurance. And over 75% of people without health insurance are above the federal poverty line. Over 50% of people without insurance make twice the federal poverty line. This is because, 1, the federal poverty line is a joke, but also 2, health insurance is just too damn expensive. Even when people are making a decent salary, they still can't afford health insurance and all of their other expenses. I'd also like to note that most people without health insurance are racial or ethnic minorities, especially Hispanic people, making up about 41.1% of the uninsured population. This problem affects those who are already at a disadvantage in the US the most. You can add health insurance to the long list of problems affecting minorities. Additionally, you need health insurance to afford drugs. The regular cost of drugs is quite frankly ridiculous. For example, here are the costs for some of the biologics that could treat Crohn's disease. Keep in mind that these are usually taken every 8 weeks, and some of the costs may actually be higher, as multiple quantities may be used for a single infusion. Humira, $7,300 for 2 single-dose injectable pens. Remicade, which is what I was on, $509.68 for 1 injection. Skyrizi, $10,665 for 1 IV injection. Stelara, $2,141 for one 5 milligram IV injection. And the actual cost for that one, I believe, is higher, since you would have multiple of those 5 milligram injections in one infusion. Entyvio, $9,135 for one IV injection. Without insurance, only the richest among us could afford to take any of these every 8 weeks for the rest of their lives. So I've been talking about insurance a lot, but I want to move on. Insurance is still going to come up, but I want to move more towards the perspective of expenses for our country and for individuals. From an Atlantic article, quote, out-of-pocket spending for people, even with employer-provided health insurance, has increased by more than 50% since 2010. And, quote, half of all insurance policyholders faced a deductible of at least $1,000, end quote. Meaning that many people have to spend $1,000 in medical expenses before health insurance even begins to help. And, quote, for people who buy their insurance via one of the Affordable Care Act's exchanges, that figure will be higher still. Almost 90% have deductibles of $1,300, end quote. The article also notes that those with chronic illnesses, such as myself, have to pay more, but everyone will have medical expenses throughout their lives. Needing to go to the doctor is an inevitability. This article, it's also from 2017. Since then, these issues have only gotten worse. Let's also talk about debt. Surprisingly, not too many people actually have medical debt, but of those who do have medical debt, many have an overwhelming amount. Quote, approximately 14 million people, 6% of adults in the US owe over $1,000 in medical debt, and about 3 million people, 1% of adults, owe medical debt of more than $10,000. While medical debt occurs across demographic groups, people with disabilities or in worse health, lower income people, and uninsured people are more likely to have medical debt, end quote. Also, I'm going to show you this graph. 78% of total medical debt in the US is from people who owe over $10,000 in medical debt. Again, 78% of the US's medical debt is from people who owe over $10,000 in medical debt. While everyone can struggle with medical expenses, it's worse among those with disabilities, chronic illnesses, and lower incomes, as the Atlantic article and the evidence on debt both touched on. Those who are already vulnerable are most at risk of struggling with medical expenses. Nationally, medical expenses are staggering. From the government agency Centers for Medicare and Medicaid Services, quote, NHE, National Health Expenditures, grew 7.5% to $4.9 trillion in 2023, or $14,570 per person, and accounted for 17.6% of gross domestic product. And from the OECD, in 2022, healthcare spending per capita in the US was $12,555. The second most expensive country was Switzerland at $8,049. Compared to Switzerland, the second most expensive country per capita, the US is about 56% more expensive. That is crazy. But despite this insane amount of healthcare spending that the US has, we're not seeing better health outcomes than other countries. Our life expectancy is lower and satisfaction is lower. From a 2022 West Health Gallup poll, quote, 44% of Americans give the US healthcare system an overall grade of D, poor, or F, failing. 3/4 of respondents, projecting to over 190 million Americans, give healthcare affordability a D or F. More than 1/4 of adults, 27%, representing about 70 million Americans, report that if they needed access to quality care today, they would not be able to afford it. Rising healthcare costs forced nearly 4 in 10 Americans in the past 6 months, as of the survey, to delay or skip healthcare treatments, cut basic household expenses, or borrow money to pay medical bills. And according to current research, 1 out of every 6 report cutting back on care they needed in the past year to pay for other essential needs like food and rent, end quote. Our exorbitant expenses aren't helping our health outcomes. It's forcing people to choose between cutting back on essentials like food and rent or on their healthcare. The American Hospital Association also estimates, quote, nearly 30% of Americans say they haven't taken their medication as prescribed due to high drug prices, and it is estimated that 1.1 million Medicare patients alone could die over the next decade because they cannot afford to pay for their prescribed medications, end quote. Again, that's 1.1 million Medicare patients alone, just Medicare, that could die in the next decade because they can't afford prescriptions. Everything I've mentioned is really bad. Claim denials, prior authorization, PBMs, healthcare expenses, drug costs, medical debt, people skipping treatment and medications, and so on. It's hurting and killing ordinary Americans. Obviously, health insurance shouldn't exist, but what about the larger fact that healthcare simply costs money? Even if we abolish health insurance and massively lower healthcare costs, as long as it isn't free, someone won't be able to afford it. What do we do about this? Well, it's time we revisit the question I posed at the beginning of this video. Is the existence of the health insurance industry and the commodification of healthcare ethical? We've answered that first part of the question, but what about the second part? What is commodification? The Cambridge Dictionary defines it as, quote, the fact that something is treated or considered as a commodity, i.e. a product that can be bought and sold, end quote. Healthcare is commodified because rather than being a service that is provided, it is produced and sold at a price, and it is subject to markets. However, since demand for healthcare is inelastic, i.e. it does not change with price as other goods and services do, healthcare companies can charge as much as they want, and most people will still pay for it because humans definitionally need healthcare to stay healthy. Decommodification, thus, means to make something no longer be a commodity, to remove it from markets. Although it does not necessarily require making something free, it often does. I'm going to argue that decommodification is the best way to solve this problem of healthcare costs. In fact, I have a specific policy in mind, one that has been proposed in Congress. I'm sure you saw it coming from miles away. I'm going to be talking about
a Medicare for all.
Medicare for all. Medicare for all.
From Bernie Sanders' website, it would, quote, create a Medicare for all, single-payer national health insurance program to provide everyone in America with comprehensive health care coverage, free at the point of service. No networks, no premiums, no deductibles, no copays, no surprise bills. Medicare coverage will be expanded and improved to include dental, hearing, vision, and home and community-based long-term care, inpatient and outpatient services, mental health and substance abuse treatment, reproductive and maternity care, prescription drugs, and more. And it would stop the pharmaceutical industry from ripping off the American people by making sure that no one in America pays over $200 a year for the medicine they need, by capping what Americans pay for prescription drugs under Medicare for all, end quote. This alone is enough to support the program, in my opinion. Healthcare should be free. Otherwise, we literally condemn people to die simply because they don't have enough money and happen to get sick. It would stop health insurance companies and the healthcare industry from draining our wallets, which are already under so much stress due to the rising cost of living. But let's strengthen the case even further. Outside of this perspective on human rights and human dignity, why would it be a good policy? I'll read some lines from a 2020 study which found that over 37 million Americans are entirely without health insurance, and 41 million more have inadequate access to care. We estimate that ensuring healthcare access for all Americans would save over 68,000 lives and 1.73 million life years every year. Our calculation of the life-saving potential of the Medicare for All Act is highly conservative in a number of aspects. Additional lives would likely be saved through the improvements in continuity of care, facilitated by a single-payer system. Furthermore, this calculation does not incorporate the improvements in survival from fully insuring the 41 million Americans who are currently underinsured, and therefore forego necessary care. This last part is especially important because based on the other evidence I've discussed, a lot of people are foregoing care and skipping prescriptions to save money due to high healthcare costs, even with insurance. So all of this sounds great, but Emmett, what about the cost? Government healthcare would be so expensive. We can't afford that, right? Well, the first study also found that, quote, we calculate that a single-payer universal healthcare system is likely to lead to a 13% savings in national healthcare expenditure, equivalent to over $450 billion annually. And, quote, additionally, the substantial cost of managing employee healthcare benefits will be relieved, a factor which we conservatively do not include in our calculations, end quote. Admittedly, these authors clearly have a bias in favor of Medicare for all. One of them even praised Bernie Sanders on Twitter. So let's look at a couple different studies. The Congressional Budget Office estimated that a plan similar to Medicare for all would save about $650 billion in national health expenditures annually. This is not a partisan or biased source. This is the Congressional Budget Office, which is nonpartisan, and it estimates that Medicare for all would actually save more than a biased study found. But even a clearly biased source unintentionally admitted that Medicare for All would still save us money. A 2018 study from the Mercatus Center, which has been in large part funded by the Koch brothers, prominent billionaires who funded libertarian and right-wing projects, with Charles Koch being an emeritus member of the board of directors, concluded that Medicare for All would cost $32.6 trillion over the next decade. In 2016, annual national health expenditure was $3.3 trillion a year, meaning $33 trillion over a decade, more than the $32.6 trillion estimate by the Mercatus Center. It's also important to note that since the writing of the study in 2018, NHE, national health expenditure, is now $4.9 trillion. It's just ballooned out of control. Additionally, quote, Medicare for All would result in significant savings for the country because of lower prescription drug costs, saving $846 billion over the next decade. Streamlined administrative costs under the plan would save another $1.6 trillion, the researchers at the Mercatus Center found, end quote. Again, this is coming from a source whose interests are in keeping the current system going and justifying the actions of the capital class. So Medicare for All would save lives, produce better health outcomes, and save us money. But do people really want Medicare for All? Yes. A poll in 2020 found that 69% of registered voters supported Medicare for All. Even among Republicans, support was 46%. It's a popular policy with majority support. Besides, people are clearly fed up with health insurance and healthcare costs. Remember the reaction to the United Healthcare CEO Brian Thompson being killed? It was overwhelmingly disdainful towards the CEO and positive towards the alleged killer. It's clear that Medicare for All is the easiest and best solution to our American healthcare woes. It would streamline a bloated Kafkaesque system. It would end medical expenses, saving lives and money. I see no reason why we shouldn't adopt it. But unfortunately, it doesn't have enough support right now. Even if every Democratic politician voted for Medicare for All, it still wouldn't pass in either the House of Representatives or the Senate, and Trump certainly wouldn't sign it. So, what can we do? Well, some would say to follow in the footsteps of Luigi Mangione, who allegedly killed Brian Thompson. I have no official opinion on that for legal and ethical reasons. Here's what I think you should actually do if you can. Look at political candidates, especially during primaries. Compare their healthcare policies. If one is vaguely pointing at reform or lowering costs, and the other directly says Medicare for All, single-payer system, universal healthcare, national health insurance, or anything similar, you should vote for the latter. The former might help healthcare costs, but the other will actually vote for something that brings fundamental change, not just small band-aid solutions. Inform yourself. Keep updated on changes in healthcare policy, locally or nationally. You'll surely want to know if the Affordable Care Act, also known as Obamacare, gets repealed, or more optimistically, if something gets passed on a local level that you might be able to benefit from. You as an individual can only do so much though. If we want broad societal change that is guaranteed to help everyone, then we'll have to wait for the government to stop an out-of-control industry. Thank you for watching.